Breast cancer is the most common invasive cancer in women. It affects 1 in 7 of women worldwide. This awareness video contains information about types, symptoms, causes, risk factors, prevention, diagnosis and treatment of breast cancer. Breast cancer happens when cells in the breast grow and divide in an uncontrolled way, creating a mass of tissue called a tumor. Like other cancers, breast cancer can invade and grow into the tissue surrounding the breast. It can also travel to other parts of the body and form new tumors. Breast cancer is most often diagnosed in adults over the age of 50, but it can occur at any age. Types of breast cancer include infiltrating ductal carcinoma. Starting in the milk ducts of the breast, this cancer breaks through the wall of the duct and spreads to surrounding breast tissue. Making up about 80% of all cases, this is the most common type of breast cancer. Ductal carcinoma in situ, also called stage 0 breast cancer. Ductal carcinoma in situ is considered by some to be precancerous because the cells haven't spread beyond the milk ducts. This condition is very treatable. However, prompt care is necessary to prevent the cancer from becoming invasive and spreading to other tissues. Infiltrating lobular carcinoma. This cancer forms in the lobules of the breast, where breast milk production takes place, and has spread to surrounding breast tissue. It accounts for 10% to 15% of breast cancers. Lobular carcinoma in situ is a precancerous condition in which there are abnormal cells in the lobules of the breast. Triple-negative breast cancer. Making up about 15% of all cases, triple-negative breast cancer is one of the most challenging breast cancers to treat. It's called triple-negative because it doesn't have 3 of the markers associated with other types of breast cancer. Inflammatory breast cancer. Rare and aggressive, this type of cancer resembles an infection. People with inflammatory breast cancer usually notice redness, swelling, pitting and dimpling of their breast skin. Paget's disease of the breast. This cancer affects the skin of the nipple and the skin around the nipple. Breast cancer symptoms can vary for each person. Possible signs of breast cancer include a change in the size, shape or contour of the breast. A mass or lump, which may feel as small as a pea. A lump or thickening in or near the breast or in the underarm that persists through the menstrual cycle. A change in the look or feel of the skin on the breast or nipple, dimpled, puckered, scaly or inflamed. Redness of the skin on the breast or nipple. An area that's distinctly different from any other area on either breast. A marble-like hardened area under the skin. A blood-stained or clear fluid discharge from the nipple. Some people don't notice any signs of breast cancer at all. That's why routine mammograms are so important. Breast cancer develops when abnormal cells in the breast divide and multiply. But experts don't know exactly what causes this process to begin in the first place. However, research indicates that there are several risk factors that may increase the chances of developing breast cancer. These mainly include age. Being 55 or older increases the risk for breast cancer. Sex. Women are much more likely to develop breast cancer than men. Family history and genetics. If you have parents, siblings, children or other close relatives who've been diagnosed with breast cancer, you're more likely to develop the disease at some point in the life. About 5% to 10% of breast cancers are due to single abnormal genes that are passed down from parents to children, and that can be discovered by genetic testing. Smoking. Tobacco use has been linked to many different types of cancer, including breast cancer. Alcohol use. Research indicates that drinking alcohol can increase the risk for certain types of breast cancer. Obesity. Having obesity can increase the risk of breast cancer and breast cancer recurrence. Radiation exposure. If you've had prior radiation therapy, especially to the head, neck or chest, you're more likely to develop breast cancer. Hormone replacement therapy. People who use hormone replacement therapy have a higher risk of being diagnosed with breast cancer. Tests and procedures used to diagnose breast cancer include breast exam. Your doctor will check both of your breasts and lymph nodes in your armpit, feeling for any lumps or other abnormalities. Mammogram. These special X-ray images can detect changes or abnormal growths in the breast. A mammogram is commonly used in breast cancer prevention. Ultrasonography. This test uses sound waves to take pictures of the tissues inside of the breast. It's used to help diagnose breast lumps or abnormalities. Positron emission tomography scanning. This scan uses special dyes to highlight suspicious areas. During this test, the healthcare provider injects a special dye into the veins and takes images with the scanner. Magnetic resonance imaging, MRI. This test uses magnets and radio waves to produce clear, detailed images of the structures inside of the breast. Staging helps describe how much cancer is in the body. It's determined by several factors, including the size and location of the tumor and whether the cancer has spread to other areas of the body. The basic breast cancer stages are: Stage 0. The disease is non-invasive. This means it hasn't broken out of the breast ducts. Stage 1. The cancer cells have spread to the nearby breast tissue. Stage 2. The tumor is either smaller than 2 cm across and has spread to underarm lymph nodes, or larger than 5 cm across but hasn't spread to underarm lymph nodes. Tumors at this stage can measure anywhere between 2 to 5 cm across, and may or may not affect the nearby lymph nodes. Stage 3. At this stage, the cancer has spread beyond the point of origin. It may have invaded nearby tissue and lymph nodes, but it hasn't spread to distant organs. Stage 3 is usually referred to as locally advanced breast cancer. Stage 4. The cancer has spread to areas away from the breast, such as the bones, liver, lungs or brain. Stage 4 breast cancer is also called metastatic breast cancer. There are several breast cancer treatment options, including surgery, chemotherapy, radiation therapy, hormone therapy, immunotherapy, and targeted drug therapy. The selection among these options depends on many factors, including the location and size of the tumor and whether the cancer has spread to other parts of the body. Breast cancer surgery involves removing the cancerous portion of the breast and an area of normal tissue surrounding the tumor. There are different types of surgery depending on the situation, including lumpectomy, mastectomy, sentinel node biopsy, axillary lymph node dissection, modified radical mastectomy, radical mastectomy. Chemotherapy for breast cancer may be recommended before a lumpectomy to shrink the tumor. Sometimes, it's given after surgery to kill any remaining cancer cells and reduce the risk of recurrence. Radiation therapy for breast cancer is typically given after a lumpectomy or mastectomy to kill remaining cancer cells. Some types of breast cancer use hormones, such as estrogen and progesterone, to grow. In these cases, hormone therapy can either lower estrogen levels or stop estrogen from attaching to breast cancer cells. Immunotherapy uses the power of the immune system to target and attack breast cancer cells. Treatment is given intravenously. Some drugs can target specific cell characteristics that cause cancer. The healthcare provider might recommend targeted drug therapy in cases where breast cancer has spread to other areas of the body. While breast cancer cannot be prevented altogether, there are certain things you can do to reduce your risk of discovering it at an advanced stage. These include: get routine mammograms. It is recommended to have a baseline mammogram at age 35, and a screening mammogram every year after age 40. Examine your breasts every month after age 20. You'll become familiar with the contours and feel of your breasts and will be more alert to changes. Have your breasts examined by a healthcare provider at least once every 3 years after age 20, and every year after age 40. Clinical breast exams can detect lumps that mammograms may not find.